I'm Addie Pugh.
I'm Laura Archer.
I'm Moinga Mathui, and we are here today doing our head-to-toe assessment for our 211 nursing course.
Hey, Miss Archer. My name's Addie. I'm your nurse today. How are you doing?
I'm alright, just a little nauseous.
Really?
I might push that.
Are you in any pain at all?
Yeah, my body's aching.
Okay. Have you been throwing up? I know you said you're nauseous.
I've been thrown up for the past couple days and had diarrhea for the past couple days.
Okay. When did those symptoms start?
About 2 days ago.
Okay. Have you got anything you've done been able to help your pain or your symptoms?
I haven't tried anything yet, but ginger ale seems to help.
Okay. Now, to describe your pain on a scale of 0 to 10, and 10 being the worst pain you've ever felt, how would you describe it?
A level 6.
Okay. Now, can you just say your name and birthday for me?
Laura Archer, 6/11/92.
All right, perfect. All right, Miss Archer. So you said your pain's at about a 6. Can you describe it? Is it aching, dull?
It aches right here and my back's aching. I don't know if it has anything to do with being hunched over the toilet and having diarrhea.
All right. Well, today we're just going to take a little bit of a look and listen to you and see what's going on, all right?
Okay.
You let me know if anything I do causes you pain and you need me to stop.
Okay.
All right, Miss Archer, do you know what year and who's the president?
Trump in 2017.
All right, and do you know where you are and why you're here?
Leslie Long Hospital, and I'm here for my nausea and vomiting and diarrhea.
All right, very good. All right, Miss Archer, I'm just going to get your vital signs before we begin, okay?
The nurse will get a complete set of vital signs, including temperature, pulse, respiration, oxygen saturation, and blood pressure.
Hold that. Thank you. Very good. Now your temperature was normal. It was 98.1. Very good, Ms. Archer.
Now that the nurse has assessed her vital signs, she will begin the head-to-toe assessment, beginning with the assessment of the 12 cranial nerves.
All right, Ms. Archer, I'm just going to check your cranial nerves, okay? All right, this first cranial nerve is the olfactory, and so I'm going to give you 2 different things to smell, and you let me know what they smell like to you and if you have any trouble smelling them, okay?
It smells like coffee.
Very good. Your last one.
It smells like pickles.
Hopefully that doesn't make you sick.
Next, the nurse is going to assess cranial nerve number 2, which is the optic nerve, and she will assess for a field cut, visual field cut.
All right, Miss Archer, you let me know when you can see my fingers. You just look straight ahead, okay?
See it.
Okay.
See it. See it.
All right.
See it. See it.
All right, very good.
Now, the nurse will assess the 6 cardinal gazes with a pen light. This will assess cranial nerves numbers 3, 4, and 6.
All right, just look straight at the tip of my pen light and just follow it, okay? Very good.
Now the nurse will have the patient close her eyes. She will touch her face with a sharp and a soft object on the forehead, cheeks, and jaw. This will assess cranial nerve number 5.
All right, can you just close your eyes for me? You're going to feel something sharp and something soft. Now I want you to describe it to me. It'll be on your forehead, your cheek, and your jaw, okay?
Sharp. 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 Soft. 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 Sharp. Sharp. Sharp.
Very good.
Now the nurse will test cranial nerve number 7. She will ask the patient to smile, frown, puff out her cheeks, and lift her eyebrows.
All right, Miss Archer, can you lift your eyebrows up for me? Can you smile? Can you frown? All right, puff out your cheeks. Very good.
The nurse will also assess alterations in taste by having the patient to taste something salty.
All right, Miss Archer, I have something salty for you to taste, and you let me know how it is, okay?
Definitely salty.
Very good.
To assess cranial nerve number 8, the acoustic or vestibulocochlear nerve, the nurse will use a tuning fork, or she will have the patient to tell when she can hear the nurse's fingers coming closer to her.
All right, I'm just going to check your hearing, so you let me know when you can hear my fingers, okay?
Here.
All right.
Here.
Very good.
Next, she will assess cranial nerve number 9, which is the glossopharyngeal. The nurse will ask the patient to swallow a small amount of water.
All right, I have 30 cc's of water here, and I'm going to have you swallow it, okay? You let me know if you have any pain or trouble. All right, and she didn't cough, so we won't need a swallow test.
To assess the vagus nerve, which is cranial nerve number 10, the nurse will ask about any episodes of fainting and check the gag reflex with a tongue depressor.
All right. Have you had any episodes of fainting lately?
No, I'm just kind of lightheaded from my symptoms.
Okay. Now I'm going to check your gag reflex, all right?
Okay.
Stick out your tongue. Very good.
Next, the nurse will ask the patient to shrug her shoulders. This will assess cranial nerve number 11, which is the spinal accessory nerve.
Okay, for this cranial nerve, we're just going to have you lift your shoulders up to your ears like that. Very good.
The nurse will assess cranial nerve number 12, the hypoglossal, by assessing swallowing or slurred speech.
Since we've already assessed your swallowing and I haven't heard you slur your speech, we've checked cranial nerve 12.
Right, so the nurse has already assessed fermentation, so now she's going to examine her head to check for any bruising, pain, lacerations, abrasions, as well as checking her sinuses for any pain or tenderness.
Okay, you let me know if you have any tenderness or pain, okay? No bruises?
No.
You haven't fallen lately or any recent concussions?
No.
Okay.
No tenderness either.
Okay, good.
Using her pen light, the nurse will now check her eyes for Perla, and she will dim the lights.
All right, I'm just going to dim the lights, and I'm going to make sure your pupils are equal, they're round, and they react to light, okay? All right, so that was your consensual response. Your other eye constricts or dilates when I move this pen light in, and your pupils react to the light. They're both round and reactive, so that's very good. Okay, I'm just gonna have you look across the wall at that light over there, and now look straight at this tip. Now do it one more time for me. right, very good. All right, Miss Archer, I'm going to check your sinuses, so you let me know if there's any tenderness, okay?
No tenderness.
Okay, very good.
The nurse will now check the conjunctiva of the eye.
Okay, pink and moist. All right, I'm just going to look up your nose. I'm checking for a deviated septum, and I'm checking the skin integrity under your nose in case you had oxygen, which you do not have. Do you wear hearing aids?
No.
Any surgeries like a myringotomy tubes when you're little?
No.
Okay. I'm going to check your other ear. Very good. All right, Miss Archer, can I have you stick out your tongue for me? Okay. Are all your teeth intact? You don't have any dentures?
No dentures.
Okay. Can you lift your tongue up for me to the roof of your mouth? All right, very good. Now I'm going to actually touch your tongue, move it around. We're looking for sores or anything like that, okay?
Now that she's assessed her mouth and her ears, she will check her neck to make sure the trachea is midline as well as her carotid pulses.
All right, take a swallow for me. All right, do you have any soreness at these lymph nodes?
No.
Now she will begin to check the upper extremities as well as continuously check the skin.
All right, Miss Archer, can I get you to move your arms up and around? Very good. Okay. I'm going to check your radial pulses. Your brachial. And your capillary refill. Can you squeeze my hands? Now pull them towards you and push them away. All right, very good. Now I see you don't have an IV. If you did have an IV, I would have to flush it to make sure it was patent. And then I would also check if it was saline locked or clean, dry, and infusing. Okay.
Now that she has checked her upper extremities for any edema, tenderness, or deformities, she is going to move on to check her chest and listen to breath sounds.
Okay, I'm going to take a listen to your heart, okay? I'm just looking for the point of Louis, going one intercostal down to the right, which is the aortic, one over, pulmonic, down to herbs, going tricuspid. We'll go midclavicular, and that's the mitral, and we'll take the apical pulse for a full 60 seconds. Very good. I'm going to go ahead and listen to your breath sounds while I'm here, okay? Take a deep breath for me. One more. One more. Very good, Miss Archer. Do you perform a monthly breast exam?
No, I do
Okay, so every month at the same time, but not while you're on your period, you should perform a monthly breast exam. So maybe while you're in the shower is a good time. And also, I'll teach you how to do it, but maybe when you get out of the shower, you should put your hands on your hips, look in front of the mirror, and see how they hang, if one is bigger than the other or hangs lower. So I'm going to want you to put your arm up, and I will move my fingers around in a circular motion, and I will never pick my fingers up off, and I will make my way to the center of the breast, and when I get to the nipple, I squeeze it like so to see if there's any discharge or anything, drainage that comes out, and I do the same. I start right here, kind of right under the armpit, and perform the same on that side as well. And so that's the procedure that you're going to want to do about once a month, okay?
Now she will assess the abdomen.
Okay, do you mind if I lift your shirt up? All right, so I'm looking for any distension, any roundness. Okay, your skin integrity looks good. I'm just going to take a listen. Your bowel sounds are active. Any pain?
It's tender.
Tender. All right, you're going to feel me percuss. Okay. When was your last bowel movement?
It was yesterday.
Okay, was it normal for you?
No, typically I go about once every other day, but it's usually solid. It's been loose.
Okay, so it was pretty soft.
About 5 times recently.
Okay.
A day, so
Okay, so
yeah,
a lot more
not
often.
normal, yeah.
Okay. All right, I'll make note of that. All right, are you having any trouble urinating? Any pain?
No, not at all.
No? Okay. Are you sexually active?
Yes,
Okay, are you practicing safe sex?
I am.
All right, very good.
And now the nurse will assess her lower extremities.
Okay, I'm just going to check for the femoral pulses right now. Very good. Do you have any trouble walking? I saw you ambulate to the bathroom and I didn't see any issues, but at home do you use a walker or a cane or any assistive devices?
No.
Okay, very good. If I could just have you bend your legs up for me. Checking the popliteal pulse. Now I'll also check the dorsalis pedis. The posterior tibialis. Now I'm checking for any edema, your skin integrity, any discoloration. All right, can I have you point your feet? Or you can lay your feet down, yep. Now point your feet. Now pull them back. All right, very good. Now because the head of your bed's at 30 degrees, I'm checking for any jugular vein distension. Very good. All right, can you move your feet around for me? Do you have any trouble?
No.
All right, very good. I'm checking your capillary refill. Great, it's all less than 3 seconds. Okay, I'm gonna have you sit up and I'm gonna listen to your lung sounds, okay? So if I could have you sit up and just hug yourself. All right, every time I place my stethoscope, I want you to take a big deep breath for me. All right, very good, Miss Archer. I'll let you lay back down. Now I'm going to flatten your bed out. And I'm going to have you roll over to your left side. And we're going to check your back. All right, take a roll. I'm going to lift your shirt up, okay?
Okay.
Now I'm checking your skin integrity. I see you have a mole here. It looks completely normal. Now I'm also checking the sacrum area, making sure there's no skin breakdown or any redness, potential bed sores developing. All right, very good. You can roll back over. All right, Miss Archer, do you have any questions?
No.
How's your pain now that I finished the assessment?
It's going down.
Okay.
About a 5.
All right, very good. I'm just going to lift your head back up, get you comfortable. I have your call bell right there. If you need anything, don't hesitate to press that button, okay? I'm going to go document my findings, and you just let me know if you need me, okay?
And this concludes our head-to-toe assessment.